Ugh, it's that feeling, right? The one we all dread. That sudden throb, that unexpected crunch, or the horrifying moment you realize a piece of your tooth is, well, not where it's supposed to be. The panic just floods in. But hey, before you spiral, just take a breath. We're gonna get through this. Let's dive in and give you a real first aid guide for handling a tooth crisis until you can get to a professional.
Okay, so there you are. You've got this sudden, pretty serious problem happening in your mouth, and of course, the dentist's office is closed. So what do you do? Like right now, in this very moment, what can you do to manage the pain, stop it from getting worse, and give yourself the absolute best chance for a good outcome? That's exactly what we're going to break down step by step. Now, before we go a single step further, we have to be crystal clear about this. This part is super important. Everything we're about to talk about is temporary. Think of it like dental first aid. These are hacks to get you through the immediate crisis. They are not, and I'm going to say it again, not a replacement for seeing a qualified dentist. This is just what you do in those minutes and hours before you get to that appointment. First up, let's tackle the big one, the most common culprit, the dreaded toothache. You know, that persistent, throbbing pain that can just completely derail your entire day or night. Let's walk through the immediate game plan to get you some relief fast.
Here are 3 simple, super effective things you can do. First, gently rinse your mouth with some warm salt water. It's like a natural disinfectant, and it can help clear out any little bits of debris that might be causing the irritation. Second, grab a cold compress and put it on the outside of your cheek for about 20 minutes. That's going to help with inflammation and kind of numb the area. And third, a classic for a reason, a tiny bit of clove oil on a cotton swab applied right to the tooth. It's got this stuff called eugenol, which is a natural anesthetic. But seriously, use it sparingly. A little goes a long way.
Okay, now this slide is so important because it points out a huge mistake people make. So yes, absolutely use that cold compress on your cheek. It's your friend. But what you should never do is put an aspirin or any other painkiller right up against your gums. You might think, oh, it'll give targeted relief, but nope. It can actually give you a chemical burn on your gum tissue. And trust me, that just makes a bad situation so much worse.
All right, moving on from aches to actual breaks. What do you do about that awful crunch moment? You bite down on something and just feel a piece of your tooth totally give way. Whether it's a tiny little chip, a crack, or a major break, here is your immediate action plan.
First things first, rinse your mouth with some warm water to clean everything out. Now, if you can find the broken piece of your tooth, save it. Seriously, put it somewhere safe. Your dentist might actually be able to reattach it. If there's any bleeding, take a piece of clean gauze, put it over the area, and apply some gentle pressure till it stops. And just like with the toothache, a cold compress on your cheek is going to be a lifesaver for keeping that swelling down.
But what if it's not just a chip? What if the entire tooth gets knocked out? Okay, this is a whole different level of emergency, and I really need you to pay close attention here, because in this situation, a clock starts ticking, like immediately. And this slide just lays it all out. Time is everything. You've got the best shot at saving that tooth if you can get to a dentist within an hour. So in the first few minutes, find the tooth. When you do, pick it up by the crown. That's the part you chew with, not the root. If you touch the root, you can damage the cells they need to reattach it. If it's dirty, just a quick, gentle rinse with water. Then you gotta preserve it. The best place is actually right back in the socket if you can manage it. If not, pop it in a small container of milk. Then you need to get to an emergency dentist like right now.
All right, let's talk about another really common one, that weird empty gap where a filling or a crown used to be. It can feel super sensitive and kind of alarming, but don't worry, it's totally manageable in the short term.
So if a whole crown comes off, find it and keep it in a safe place. There's a good chance your dentist can just clean it up and re-cement it. Now that exposed tooth underneath, it can be crazy sensitive to hot, cold, and even air. A little dab of clove oil can really help with that discomfort. But the main thing here is to cover that area to protect it. So how do you cover it? Well, your best option is to get some over-the-counter temporary dental cement from a pharmacy. If you can't do that, a piece of orthodontic wax can work in a pinch. And as a total last resort, you can use a small piece of sugar-free gum. I have to say it again, sugar-free. The absolute last thing you want is to pack sugar into a tooth that's already vulnerable.
So we've covered toothaches, chips, lost crowns, but all of these temporary fixes, all these hacks, they're all pointing to one single non-negotiable goal, the one step that actually fixes the problem. So what is it? What is the absolute, hands-down, #1 priority in all of this? It's not the salt water, it's not the clove oil, it's something much, much simpler.
It's this. Just let this sink in for a second. Home remedies manage the crisis. A dentist solves the problem. Everything you do at home, that's just damage control. It's pain management. You're just buying yourself time to get to the one person who can actually fix what's wrong.
And that is really the key takeaway from all of this. Feeling a little better after using a cold compress is great, but it doesn't mean the problem went away. The infection, the crack, the cavity, whatever it is, it's still there, just waiting. These hacks buy you time. That's it. They don't buy you a solution.
So I'll leave you with this final and most crucial question. If you're watching this right now because you're in the middle of a dental emergency, I really hope these steps have helped you out. But have you picked up the phone yet? Have you found an emergency clinic? Because that right there, making that call is the only hack that truly matters.